Okay, so today for our community health webinar, we're talking about breast health and why it matters, and we have Amanda Hill as our presenter today. Amanda has served for nearly 15 years on the Pine Ridge Indian Reservation. Originally from Sioux Falls, she first came to Pine Ridge as a nursing student in January 2004. She graduated from Augustana College with a dual degree in nursing and biology in 2004. As a new graduate, she began work in the obstetrics unit at Pine Ridge Indian Health Services. And Amanda has been dedicated to providing healthcare to women in the Great Plains area, continuing her work and graduating with a Master's of Science in Nursing Midwifery from the University of Pennsylvania in 2007. Amanda has been a commissioned officer in the U.S. Public Health Services Commissioned Corps since 2010. And after 13 years as a nurse midwife and serving as a sexual assault nurse examiner, certified lactation counselor, and community nurse midwife, Amanda was recruited to the Great Plains Tribal Leaders Health Board to expand women's healthcare and reproductive healthcare to women at the Oyate Health Center. She is excited for this new adventure, and she sees her role as a reproductive health advocate for all women. She recently moved from Pine Ridge, South Dakota to Rapid City, and she has 2 children, Robin and Callie. With that, I'm going to pass it over to Amanda and let you get started. Thank you so much for presenting with us today.
Great. Thank you so much for having me. I'm really happy to be here. And I presented this last week with the Honor Every Woman program, and just got a lot of good feedback. And I was really happy to be invited by Shannon and the Wellness Committee to spread the discussion about breast health. Certainly, you know, it's Breast Cancer Awareness Month, but I think more importantly, what we should talk about is that it should be Breast Health Month. That taking care of ourselves, taking care of our bodies may prevent breast cancer in the future. So it's not just about awareness for the cancer itself, but just being a healthy woman. And that is so important in our lives. Let's see here. There we go. Okay. So just a quick review over the objectives. Those were on the webinar handout this morning. We're going to review the anatomy of the breast, the impact of breast cancer on women, and incidence of breast cancer in Indigenous populations. We're going to look at the screening guidelines, as well as the Honor Every Woman program and what that might entail for our family members, and risk factors for breast cancer, as well as talking about the ceremony of self-care and the importance of breast health in our lives, as well as how to manage historical trauma, PTSD, and intimate partner violence that may create some barriers or some walls for some of our relatives in seeking out preventative health care, and then as well as complementary and alternative methods to help relieve anxiety for those procedures and for increasing access and acceptance of preventative health screenings. The first part of this slideshow is an excerpt from Get on the Path to Breast Health from Linda. She is a doctor at the Native American Cancer Research Foundation, and this was forwarded thanks to Walking Forward program from Avera Health and Dr. Dan Peteray. So the first screen here, I think I just really love this, is that we really want to check your Aze in Lakota, or however your tribe's word for breasts, and knowing the signs and symptoms of the different problems that might appear. And certainly it used to be recommended to do a monthly self-breast exam in the shower or in your bed every month. And they've gone away with that because the detection is a lot less. However, I think knowing your breast, knowing your body, knowing your general health is really important. And then knowing these signs of breast cancer are really important. So I'm just going to kind of go clockwise. So fluid leaking from the nipple, especially if it's asymmetrical, if it's just one side of the breast, if the fluid is brown or red, bloody, black, those would be concerns for cancer. Certainly flaking or peeling of the nipple, a crust, it just doesn't go away. Change or the size of one breast can be concerning. And then bumps, thicker heart or hard areas, inverted nipples, if one nipple all of a sudden pulls in or looks different, sores, maybe you think you scratched yourself or you got a spider bite and that area just doesn't heal up. Those would certainly be concerns that you'd want to come to your provider and have checked out. Dimples or areas of skin that feel like an orange peel can be very concerning for an inflammatory breast cancer, or areas that look hot, inflamed, or are warm to the touch. And of course, any new growth of a blood vessel, that blood vessel may be feeding a cancer. So if you see those, I think a lot of times fear drives us away from getting checked, but fear should drive you to, and the opportunity to get an early diagnosis is most important. In the breast structure, the breast cells are not just the area in the chest, but all throughout the chest area. So it's not just what's supported in our bras. The tissue is in your chest wall all the way up to your collarbone and extends all the way under our arms. It's also important that our trans population, our two-spirited relatives that are transgendered females that have not had a mastectomy or that have transitioned and have had breast augmentation are also at an increased risk of breast cancer. And so they also still need to be considered at risk and get their annual mammograms. The tissue goes all the way up to our breastbone, so it's very wide and throughout the whole structure. You can see here in this slide that a lot of breast cancers occur not in what we can generally consider the breast area, but in the upper quadrant up into our armpit. So although the breast is all over our chest wall, most breast cancers occur up in that upper outer quadrant. And this slide divides the breast into 4 areas and shows how the cancer is in each area. Cancer under the nipple is also very common and more common than most people realize. And that's why it is very important for some to make sure that in a clinical breast exam, you include the nipple area and you're pushing in and around that area as well. Again, here's another picture of different breast areas and some of the anatomy. The ducts of the breast. So when we breastfeed, we always think that it just comes out of one hole, but breastfeeding, it actually looks more like a shower. And there's multiple ducts through the whole breast that contain that milk. And so any of those ducts throughout the whole breast can contain or cause and grow breast cancer. So you can see that there's multiple ducts and that there's also lobules that are the milk producing sacs. When a woman is breastfeeding, sometimes those sacs can get clogged or overfilled, and that can cause pain or a bump. So in a breastfeeding woman, a bump isn't necessarily cancer, and that'd be certainly something that we'd want to check out. And then if you look all the way up into this picture's armpits, the axilla area there's lymph nodes. And so we have lymph nodes through our whole body. They start in our neck and they go behind our neck, all the way down through our throat, into our armpits, down through our abdomen and into our groin. Lymph nodes are the cleansers of our body. They suck out the infections and help our bodies process those infections. However, because it's like a highway through our whole body, if there are cancerous areas in other glands adjacent to those lymph nodes, like in the breast cancer can spread to the lymph nodes, and then those lymph nodes can cause the cancer to spread throughout the whole body. So hormones throughout the whole breast are substances that are secreted by glands in the body. And we're going to talk a little bit more in detail about the different hormones that affect breast health. Here's a great picture. Know Your Lemons campaign is a campaign that really uses lemons and just those diagrams so that we're not just looking at a picture of a breast, but we're really looking at identifiable differences. And so this is just another image of different things that might be going on with our body. And if you see any of these hard things or changes, that you should definitely have your provider take a look. I love the last one here in the corner it says a hard lump, and you can see that that seed is a hard lump, but it's way deep inside. So on the surface, we may not feel that hard lump, especially in the lemon. You can't feel the seeds inside a lemon or an orange, but they're still there. And that's very characteristic of breast cancer as well. We may not feel the lump, and that talks about why it's so important to get mammograms done early, because we can see those lumps and those cancerous areas through mammograms and ultrasounds much earlier than before you see it. For the breast cancer, there's at least 15 different types of breast cancer, and each different type has a different treatment. There are different types and they spread and act differently in the body. For example, some types of breast cancer can spread as an initial tumor, whereas other types of breast cancer in the duct, and we'll talk about that in a second. Ductal breast cancer is very common and it can be very slow to grow. So even if you get diagnosed with ductal breast cancer, it may take up to 7 years before it begins to spread. So that's one reason why treatment and long-term care options for breast cancer can vary. Looking at the impact of breast cancer on women, there's the number of new cases of female breast cancer is about 126 per 100,000 per year. This number, the deaths have continued to decline over the years. And so right now we're about 20 deaths per 100,000 women. That's a pretty low percent. Of most women, 12% will be diagnosed with breast cancer at some point in their lifetime based on older data, and that's still pretty consistent. So here's a newer updated slide that shows that the localized breast cancer is about 63% of our initial diagnoses. And that means it's confirmed to our primary site. So treatment might just be removal of that lump. It might be a partial lumpectomy or partial mastectomy with a reconstruction versus a drastic mastectomy, including lymph node removal. And then when it spreads regionally to 20, that includes about 29% of cancers. And overall, there's a 99% 5-year survival rate for women who have a diagnosis in the localized area. That's a large percent. If you include the regional diagnosis, so that includes almost 98%, or sorry, 94, 95, 96% of our breast cancers. If you include the regional breast cancers as well, there's still an 97 to 98% survival rate in 5 years. So it's really important that we not shy away from detection or prevention and early recognition of breast cancer, because so many of these are survivable. Here you can see that of all types of breast cancer, the female breast cancers contain about 14% of all new cancer diagnoses in the country. And it affects about 281,000 women a year. Of female diagnoses, it is only second to breast and lung cancer. Here you can also see another slide just looking at the ethnicities. So fortunately, American Indian and Alaska Native women have been very fortunate to have a decreased risk of breast cancer in the United States compared to our white and other Hispanic counterparts. However, we're still at risk of breast cancer, and so early detection is still very critical. I think this slide is more pertinent to our population and to our family and relatives. And you can see the differentiation of breast cancer incidence among our tribal relatives. And you can see that NHW stands for non-Hispanic whites. So in the same region of those areas, the Northern Plains women still have a lower incidence of breast cancer than their non-Hispanic white counterparts in this area. However, we can still see that our risk of breast cancer in this area is still lower than women who may be living in the East or the Pacific coast, and certainly the Southwest. And some of that can be discussed by our exposure to vitamin D and our absorption of vitamin D. So women who may have a high vitamin D diet with salmon and different fatty oils like olive oil and avocados may have a lower incidence of breast cancer. So those women that are living in the Pacific Coast, or those women who are in the Southwest and getting exposed to a lot of sunlight, certainly do have a lower rate of breast cancer, and that may be correlated to their vitamin D levels. I love this slide. It's a great informatic. Looking at indigenous pink. So just the actual risk factors for us and for indigenous women. 1 in 8 women will get breast cancer in her lifetime. And there's a lot of things that we can't control, right? So we can't control our genetics. We can't control who we're related to. We can't control our family history of breast cancer or our age. We all get older. And we can't control that we were born a female. And breast density. So a lot of times when women are in their 40s, they may get called back for a mammogram or an ultrasound because they have denser breast tissue during that time. And that tends to thin out as we get older. So we can't control this, but things we can do are really modifiable risk factors. And that's including breastfeeding to reduce our estrogen exposure, weight control, and we'll talk more about what weight specifically does for women with breast cancer, regular mammograms once a year, exercising to not only maintain a healthy weight, but to decrease our cortisol and our stress levels, limiting alcohol use, and regular breast exams. So the screening guidelines, that can be kind of confusing. And about 10 years ago, there was a flurry of different discussions on when a woman should start her first mammogram. It is recommended now that women between the ages of 40 and 44 start their breast cancer screening. And certainly the sooner you can start in that age range, the sooner you could detect an early breast cancer. By the age of 45, a woman should have her mammogram every year until the age of 54. After 54, a woman can have a mammogram every 2 years, or she may continue with a mammogram every year. So it's really important that you talk to your healthcare provider and customize your healthcare preventative plan based on what's going to fit your schedule and your comfort level and your risk level the most. However, most women should continue mammograms for at least as long as she expects to live for another 10 years. So if you are 75 and you are going strong and still consider that you're going to live to be 85, then absolutely you should be continuing to do your mammograms. With the high risk screening, there are some risk factors that we can't modify. So if you have a relative that's a mother or an aunt or a sister, so a first degree relative that had breast cancer, especially on your mother's side of the family, then that would increase your risk for breast cancer. And possibly you should get a breast MRI and a mammogram, typically at age 30, or depending on when your family member was diagnosed. We usually say 10 years prior to diagnosis. So if your mother was diagnosed with breast cancer at age 39, then possibly we'd want to start at 29. If you have a lifetime risk of breast cancer that's 20 to 25% greater, we recommend these new screening guidelines. Or if you have a known BRCA1 or BRCA2 gene mutation, and those are genetic mutations that we know are driven by estrogen receptors and are strongly correlated with breast and ovarian cancer. So certainly if you had a relative with one of those genes, it's also been linked to some forms of prostate cancer, then you'd want to consider getting that type of genetic testing done. And we can do that at Oyate Health. MRIs should only be used in addition to mammograms, not as a primary screening tool. So that's important to note. I really liked this slide because I think we forget to talk about those modifiable risk factors that we can modify every single day to decrease our risk. So in this slide, alcohol increases your risk of breast cancer more than you realize. So the evidence shows that for every 1 drink a woman has, she increases her risk of breast cancer by 14%. And that's over an average. So if you have 1 drink a day, you're averaging your increased risk of breast cancer by 14%. The reason that works is that alcohol increases the level of estrogen and other hormones related to hormone receptors that are causing hormone receptor breast cancer. Alcohol also decreases your cell's response to stress and damages the DNA. So the DNA in our cells just doesn't turn off when those cells get old. They keep growing and growing, and that's what causes a tumor or a lump. So it's really important that we be aware of those risk factors. Here's another great slide, just looking at the breast cancer factors and prevention. So some of the things we talked about, if you are a relative that has chosen not to have any children or never did have a baby, that also increases your risk of certain types of cancer, especially breast cancer and endometrial cancer. So you may want to do more regular screenings. Giving birth at an older age or delaying childbearing if you have a baby over the age of 35, especially if it's your first baby, that can increase your risk. Or for our young relatives who have their first moon time before the age of 12, that just adds to a longer lifetime exposure of estrogen. So if your relatives started their moon before they were 12, that means they've been exposed to estrogen in their body for a longer period. Breastfeeding is a modifiable risk factor because breastfeeding suppresses estrogen in our bodies and it decreases that woman's exposure to estrogen over her lifetime, as well as restructuring the breast with the milk ducts and stuff, which also decreases your risk of breast cancer later on. If a woman is postmenopausal and uses hormone replacement therapy, especially with some forms of progesterone, that has been shown to be linked to breast cancer risks, and is a questionable risk factor with birth control methods, but certainly using them for the shortest duration of time or using an option with the lowest dose of hormones is very helpful. The one thing we do know is that estrogen is a hormone that can turn on breast cancer growth and turn on breast cell growth. So long-term exposure to extra estrogens and chemicals that act like estrogens can increase breast cancer risk. A full-term pregnancy, like we mentioned, makes your breast cells more fully mature, so they'll be ready to work for the first time in making milk. And then that final maturation of our breast tissue only happens during breastfeeding. So our bodies actually undergo quite a bit of change just through that biological process. I'm going to note a couple things. Let's see my next slide here. Yep. So here's just another slide. There's a whole campaign about think pink, live green. So being a good relative to the earth and being respectful of Unchimaka is also very helpful to our own breast health. Remembering that every time you eat or drink products, you have an opportunity to make healthy changes. Getting to a healthier weight and sticking to it, regular exercise, not smoking, and getting fresh air. If you are, eating fresh fruits and vegetables, which we hope you are, try and choose those vegetables and fruits that are on the best health, or what they call the dirty dozen. The dirty dozen, how vegetables and fruits and vegetables, have more chemicals and more pesticides, and so they're more likely to be linked with breast cancer and other types of cancer based on those pesticides. Certainly, if you can buy those organic, that's really helpful, or using a cleanser to clean those different chemicals off can be very helpful. So clean vegetables and fruits include onions, sweet corn, pineapples, avocado, asparagus, sweet potatoes, mangoes, eggplant, cantaloupe, kiwi, cabbage, watermelon, sweet potatoes, grapefruit, and mushrooms. So those are great to consume. Apples and lettuce, potatoes, blueberries, sweet peppers, those are different ones that are on the dirty dozen list. And so you just want to make sure that you try and buy those as fresh from either farmers markets or organic areas so that you're reducing your chemical exposure. Also looking at your plastics. So if you have a whole cupboard full of Tupperware and plastics, knowing your packaging, when you're buying fresh food and frozen beans, try and get them in bags or glass jars, and limiting your exposure to canned foods and plastics that contain BPA. We've seen studies that women who consume foods with BPA cans or plastics, that BPA, that chemical, actually excretes into the breast milk and is found in breast milk and in breastfed babies. Also, only using plastics that have the codes 1, 2, 4, and 5. The other types of plastics, 3, 6, and 7, do have estrogen modifying hormones and plastics as well as chemicals in them. So try and stay away from those. Getting fresh air includes getting enough vitamin D. The reason we talk about vitamin D is what I said before. If you don't get enough exposure, and it's hard living in South Dakota, especially as we get into our winter months. So talking to your healthcare provider about getting a vitamin D supplement to help with health prevention. So I'm just going to see here, I had a couple more things marked. Maybe not. All right. And then stress management. We talked about stress before. Exercising and getting fresh air can be helpful for stress reduction. When we have our stress reduction in our bodies, that helps with cortisol levels. Cortisol is a stress hormone that can cause us to gain extra weight. When we gain extra weight around our waist, that extra weight contains a lot of endogenous hormones, including estrogen, which can increase our risk of cancers, as well as diabetes and hypertension. So these fat cells in our body, when we have them around our waist, they make estrogen, and that estrogen makes extra fat. So it's a very vicious cycle. The fat can also collect and store many environmental pollutants that can act as estrogen. Diabetes is more common in obese individuals, as we know, and that this condition, diabetes, creates high levels of blood sugar and increased levels of insulin. Insulin also is a hormone, and big doses of high calorie foods on a daily basis can trigger some extra changes, including the insulin in our body to act like estrogen. So our whole body is connected, and I think it's really important that we are aware of that. So here's another thing, just think pink. Breastfeeding is so important. I think as all a good relative, not only is it good for the environment, it's good for ourselves as mothers because it decreases our risk of breast cancer and ovarian cancer, but it also helps our babies. So it helps with decreasing our baby's risk of some childhood diseases like asthma, allergies, ear infections, and some childhood cancers. And it's been found that for every 12 months a mother breastfeeds, her risk for breast cancer is decreased by 4.3%. So that's very helpful to know that the perfect milk for our babies, that first sovereign food that our bodies has created, is the perfect medicine to not only increase our health, but also for our baby. Research shows that mothers who breastfeed lower their risk of pre- and postmenopausal breast cancer, and that breastfeeding for longer than 6 months is recommended and can provide additional protection. So the next thing I really wanted to mention was the ceremony of self-care, and the Honor Every Woman program and I really talked about this because I think as women, we don't take care of ourselves. We're always giving to others. We're always taking care of our children and our relatives. But what does it really mean for yourself to take care of? Because if you're not 100%, if your vitamin D level is low, if you're filling your body with non-nutritional foods, if you're not getting enough water to drink, you're not at 100%. So even though you're trying to give 100%, you don't have 100% to give. So what does that mean? It means drinking clean water, eating whole foods, getting fresh air, all the things we know that can decrease your risk of breast cancer and lots of other types of cancer and health issues. But cleansing ourselves from undue stress, pollutants and toxins, and living a life that's better for our Mother Earth. Allowing, and I always think, like, we want to get your pap smear, we want to get your mammogram, we want to check your cholesterol, we want to check all these labs. So really designating 1 month to be your month. And that doesn't mean you have to do every single day, but one day, say in September or every October, you decide that that's going to be your month for you. And you make all your appointments, you get your optometry visit, you get your, your dental care, you make an appointment for your pap smear and your well woman exam, or you see your diabetes provider, and you really make sure that your mammogram is done and everything's done. And then you kind of set it on the calendar, and that becomes your ceremony day. So get dressed, eat a good breakfast, take yourself out for a treat afterwards. Maybe you go get a pedicure afterwards, or you take a friend out to coffee. It doesn't have to be expensive. It doesn't have to be very time consuming, but do take some time for yourself. So enter into your visit with your clinician as your own ceremony. This is your healing ceremony, and I really want you to seek answers. Just like when we go into ceremony traditionally and we ask for help or assistance or for healing, we should really be entering our own healthcare system seeking the same thing. So really making sure that you're asking for answers, that you come with a notepad. I always forget things, so write the questions down. Ask if you don't understand something, ask again. Ask for literature, ask for handouts, and try and create a relationship with somebody that you feel safe with. Somebody that answers all your questions, that gives you time and really develops a relationship and a good rapport with you. And listening to your body. So many times we have an ache or a pain or a lump or a bump, and we ignore it because we don't take care of ourselves. And so if you're not taking care of yourself, you can't give 100% to others. So if you do have a concern with your body, really listen to it and come to the clinic, come to a provider to seek those answers as well. I loved this screen from Honor Every Woman, and this just really talks again about the whole importance of all 4 directions for our wellness. So seeking out spiritual help from an advisor, talking to a unchi or an auntie about their history of breast cancers, getting support from a friend. Maybe you and your friend have a ceremony day together and you guys both come in for your pap smears and your well woman exams and your mammogram. You can share gas costs. Seeking guidance, pray before you come in. If you need to smudge yourself off or just take some deep breathing, that's good. Come prepared for your visit. Wear something comfortable. When you're coming in for your mammogram, try and wear a 2-piece outfit, because then you can just take your blouse off and put a gown on for the mammogram without having to feel completely undressed. Try not to wear a lot of lotions or perfumes or antiperspirants that might show up on the mammogram. That's really important to use. And if you forget, we'll have wipes. We can help you wipe that off. And try not to schedule your appointment around your menstrual cycle. One thing is that is a sacred time for us. Honor that time, but also your breasts may be more tender, more uncomfortable. So try and take that time away for yourself at another time. Remember that you'll be standing up for about 15 minutes during your mammogram. So I had my first mammogram this year, and I found that if I stretched before my mammogram, I did a little yoga, I wore something really comfortable, then my muscles were a little bit more relaxed. So when I'm standing out, stretched out like that, it didn't hurt my neck or my shoulders because I was already kind of warmed up and stretched and ready for that. If you have questions, write them down, try some deep breathing techniques. All those techniques that we did when you were in labor are amazing techniques through life. That's really to prepare you for motherhood through your lifetime. So practicing those slow, deep breathing exercises, just like you did when you were having those contractions or pain. Bring your AirPods or some headphones and listen to some music during your appointment, especially during the mammogram. That's absolutely fine. And mentally, if you're experiencing fear or anxiety, I think we're all afraid of bad results, but the longer you wait, the worse those results are going to be. So don't be embarrassed. I see breasts and pelvic exams all day long. It's like looking at your hand. And the women that do the mammograms also feel the same way. We want to take care of you and make sure that you are important and that you're well cared for. One thing to note, though, is that we do have a lot of women who have experienced trauma or violence in their lifetime. We know that 1 in 3 Indigenous women will be sexually assaulted in her lifetime. And with that comes a lot of physical manifestations and mistrust. We want you to be able to trust us, but there's a couple studies. So compared to victims of emotional abuse only, victims of physical and or sexual abuse aged 40 to 74 had an 87% decreased odds of being up to date on their pap smear and an 84% decreased odd of being up to date on their mammograms. So it's really important as a clinician that if we have women who have experienced sexual or physical trauma in her life, that we build those bridges and that we try and make them as comfortable as possible, as well as maybe we just do things stepwise. Maybe we just meet with her today. Maybe in 2 weeks, we have her come back in for her pap smear. And if we have them, on the other hand, if they want to get everything done that day, take the extra time to bundle those cares so that they can get back to their family and to their needs, because we all are very busy. And it may have taken her a lot to gain that trust to be able to come in for her visit. Among women who are 40 and older, those who reported physical and sexual abuse had lower breast cancer screenings and cervical cancer screenings. So it's really important to screen for those histories and be aware of them. So for every 1,000 women who have a screening mammogram, we can see that 100 of those women might be called back for additional screenings. 61 out of the 1,000 will have nothing wrong after those additional screenings. So it's important to realize that, a lot may be recalled, and that doesn't mean that something's wrong. Of the 61, 19 out of the 1,000 women may need a needle biopsy. And out of all of those women, only 5 out of the 1,000 will be diagnosed with breast cancer. So it's very scary to get called back. It's very scary to think that something's wrong, but we can show that so few women actually get diagnosed with breast cancer. And that if they do, we can often detect it earlier. I wanted to note as well that there are complementary therapies for self-care and anxiety reduction. Like we talked about before, dress in something comfortable, pray, smudge, and be okay with being nervous. It's okay if you're sweaty. It's okay if you forgot to shave. It's okay if you're just running from your job. You're taking care of yourself, and that deserves a seat of honor. One thing we're going to be starting here at Oyate Health Clinic is using essential oils with some different aroma tabs, especially lavender and sandalwood, to reduce anxiety during procedures, especially MRIs, breast ultrasounds, mammograms, pap smears, and colposcopies. And then also, if you have something that makes you feel comfortable, if you like the smell of vanilla or cedar wood or bare root, bring it with you and you put it in a medicine pouch, bring it with you, put your oil on your hands and use it as a little diffuser. Be okay with bringing your own traditions and your own medicine into the clinic to make yourself more comfortable. Breathing and music has been found in studies to be very helpful for anxiety. So if you need to bring your own AirPods, or if you just want to put your phone down and have some music playing while you have your mammogram, please let them know and be okay with asking for that. And deep breathing, like we talked about, stretching, I found was very helpful just to feel limber so that I wasn't waking up first thing in the morning, coming over for my mammogram and feeling maybe a little bit more stiff. So stretch before and then treat yourself afterwards. I think it's really important. So thank you. I think it's so important that we are here today. And I just thank you for your time and all of your assistance. This is my little girl when she was about 2. I couldn't get her weaned at all. But I just treasured it, that opportunity to breastfeed her and give her the milk of life was really an incredible opportunity. So I thank you for this opportunity.